Okay, welcome everyone. My given name is Bethany Montgomery, but my chosen name is Be Light, and that is because I am a being of light, and you'll learn a little bit more about that later. Welcome to Courageous Conversations COVID-19 vaccine. You decide conversation number 5. We have been doing this for 5 weeks in a row. This is the fifth and final conversation. Super excited because we have some absolutely amazing guests and we have some dope poetry from moi. So I think everyone's really going to enjoy tonight. So tonight is called COVID-19 Sharing Perspectives. Healthcare workers share perspectives on the pandemic. So again, just want to welcome you to the fifth and final show of Courageous Conversations. Just so excited. This whole thing has been an absolute pleasure and just honestly a beautiful journey to sit and have conversations with the community, about this horrible virus, and about the solutions and how we can better be there for our community. It's really exciting. And so we've got two amazing guests tonight. Dr. James Greene, he's an OBGYN at Kaiser Permanente over on MLK in Tacoma, and then also Kevin Roberts, and he's a medical assistant supervisor at the SeaMar community health clinics. They'll be telling us about their experiences on the front lines of the pandemic and talking to us about the COVID-19 vaccines. So for those of you who are new, a little bit about Courageous Conversations. It's a 5-part talk show series for Black and African American communities to receive culturally appropriate and accessible information about COVID-19 and the vaccines. We feature trusted members, leaders, and allies of our Black community, and share their perspectives, knowledge, to empower us to make decisions we feel best is for ourselves and for our loved ones. So for more information and videos from the great conversations you might have missed or you want to see again, you can check out powertothepoetry.com/courageous conversations, and we'll drop that link in the chat. So don't worry about it if you don't quite catch it right now. And so just a little bit of Power to the Poetry and what this organization hosting these conversations is all about. So Power to the Poetry, it's a performing arts organization specializing in spoken word poetry, but also just uplifting the community. We promote freedom of expression and provide a platform for underrepresented demographics in our community, including but not limited to people of color, LGBTQ+, women, youth, people with different abilities, people with mental health issues, etc. We raise awareness to social, cultural, political, and personal issues, addressing topics that cultivate crucial and courageous conversations, empowering our audience to engage in dialogue and action for meaningful change. We are warriors of light on a mission to express, expose, and ignite. Power of the Poetry is a movement providing a platform for all voices, fostering a climate of culture, diversity, and inclusion. Marginalized groups constantly deal with inequalities such as oppression, discrimination, racism, and prejudice. This is unacceptable. We take responsibility for the disparities in our community by creating opportunities for positive and necessary change while inspiring others to do the same. So if you want to learn more about Power of the Poetry, definitely check us out. Powerthepoetry.com. So just want to go over a couple little house rules before we get started. We have a few community guidelines. By being here, you are agreeing to be kind to our speakers, to our performing artists, and each other. Please mute your mic if it is not your turn to speak, and put any comments and questions for the Q&A in the chat, and use your reactions at the bottom of the screen to send lots of love and just have that energy. We're all about positive energy around here, and the best way to view this thing is in speaker view. So if you click the right top corner, there's a button that says view, and then it says speaker. That's the best way to see this thing. I promise you, that's the view that you want. So first, let me introduce our amazing speakers. Thank you all for being with us tonight. You are so appreciated. So first, we have Dr. James Greene. He is an OBGYN, again, at Kaiser Permanente, and he's been practicing for over 30 years and has been here in Tacoma for over 20 years. He specializes in endocrine disorders, minimally invasive and robotic surgeries, gender care, and menopause. Dr. Greene transitioned into an administrative role in 2016 and is presently the service line director for gynecology and midwifery for Kaiser Permanente, Washington. We have a link where you can check out more of his bio. We'll drop that in the chat. And then our next guest will be Kevin Roberts, and he's served in the U.S. Air National Guard for 6 years as a medic and an EMT. He has worked with SeaMar Community Health Centers for 16 years as a medical assistant and medical assistant supervisor. He also opened a homeless clinic through SeaMar and ran it for 3 years. Kevin now serves as the program manager for SeaMar's Community Health Action Team, which is an outreach team that provides street medical, behavioral health, and case management to the homeless population. So we'll drop more about SeaMar in the chat too. You can learn about what that organization does. It's such an amazing organization. And so our special guest, so every time, and what kind of makes this show different than other shows about the vaccine and COVID is we're all about the arts. Again, this is Power to the Poetry. This is the organization, so we're all about highlighting the arts. And so we've had some amazing musical guests, absolutely amazing. So we're gonna switch it up, and I've been super inspired by all of these guests. So I said, hey, let me close out the last show. So I'm gonna do a little bit of poetry for y'all before we get started and dive deep into COVID-19 and the vaccine. So this first piece is called Warriors of Light. I believe we are all warriors of light, and my mission is to help the world realize that and believe that. I'm part of a tribe called the Warriors of Light, using positive energy to spread good vibes. I believe love is the key to unlock peace. Anything is possible, nothing is out of reach. There is a light within us all, but sometimes we must close our eyes to see. When we look inside, we find our inner light, leading us in the direction which is always right. The fire within eternally burns bright because the good in us never truly dies. So we fight on a mission that will last until the end of time, making sure there is a light in which we can always find, using our words to ignite humankind. Power to the poetry, the Warriors of Light. And I know it's really hard, this season we've been in, this pandemic we've been in, to really see the light in it. But we really have to realize and believe that the light is within us, and that we really can be the change that we seek. This next piece is called And Still I Grow, and I think this really hits on, understanding that just because you are aware of light, you do go through darkness, but through that darkness, you can be led back to the light. I sit back and look at my life, all the battles I've had to fight, all the poems I've had to write, all the sacrifice, sleepless nights, laying in my bed, attempting to comprehend what's up in my head. Want to find a purpose, make life worth it. Been feeling worthless, far from picture perfect, that's for certain. Sometimes I don't even feel like a person, my emotions be burdens. My chest, it be burning, depression been lurking. I close the curtains, embracing my demons, channel my inner phoenix, spirit be screaming. I keep on reaching inside my soul, pulling out gold, go through highs and lows, ebbs and flows, but stay on my toes and still I grow. Say it ain't so. We always gotta grow. This next piece is called Revolution. We must promote peace and love and stop all the violence and the killing. Need to support our children. Don't you know they need our help to excel? Demolish the school to prison pipelines. No more jail cells. Please remember that the homeless are people too, and you never really know what others are actually going through. So instead of judgment, show compassion. Our character is defined by our actions. Stop being distracted and follow our passions. Be the solution to all of these problems, because Somebody must solve them. So why not us? We can do anything we put our mind to. We can all be the breakthrough. Practice being mindful. Don't become idle. Fighting for survival. Our evolution is vital. Meditate to keep our spirit full. And follow one rule. Use your inner light as fuel. Definitely gotta use our inner light. This next piece was inspired by last summer's events. You know, it's definitely been a tough time for everyone, but I feel especially for those in the Black and African American community. That they're, you know, we're fighting honestly multiple pandemics. You know, not only do we have COVID, but we also have racism and prejudice and discrimination. And you know, I was just so inspired by the Black Lives Matter movement, and I just believe that we all deserve to be treated equal. And you know, rest in peace to Manny Ellis, who was killed here in Tacoma. I wrote this piece in honor of George Floyd. It's called "Can I Breathe?" We should be able to breathe. Why can't he breathe? Why can't she breathe? Why can't they breathe? Why is it still we can't breathe? Breath. Something for most effortless, something done through our subconscious, something done until the day we die. Breath is the something that keeps us alive. Life is breath. Feel the air fill up in your chest. Now close your eyes and imagine laying on the ground, being forced down, hands behind your back and someone's knee, not just anyone, the police, pinned against your neck as your life slowly fades away due to your lack of breath. So here's a reality check. The reality is that to them, your life, it don't matter if you're Black. A truth that is sad, a truth we shouldn't have, and we are mad, we are furious. They keep killing us, we keep filming it, the tension keeps building up. When is enough actually going to be enough? How much more blood? How much longer will they continue to drag us through the mud? It seems as though society has grown numb to the inhumanity our people, Black people, have received from this country since day one. If only they could really see our pain. If only they could really know our rage. We are sick of dropping names. We are sick of digging graves. We are sick of the injustice. We are sick of us being treated like nothing. But let us add George Floyd to the very, very long list. And again, let us never forget what Dr. Martin Luther King said. Injustice anywhere is a threat to justice everywhere. We shed our tears. We bury our kids. They keep committing sin. When will it end, mama? Will it ever end? We can forgive, but we can never forget. How many more crimes will they be allowed to commit? Again and again. Another murderer with a badge dismissed. Yes, we all know change doesn't happen overnight, but we all know know wrong from right. We sure all know Black from white, and well, if you're Black, then that guarantees you're in for a fight. We fight for our rights, we fight for our lives, we fight for our justice, we fight for our sisters and brothers, we fight for one another. We stand together. You can knock us down, we'll always get back up, and well, if you kill us, we'll make sure that you feel us. And we ain't never giving up because we got us and we got love. And as always, we shall overcome. Rest in peace to all those deceased due to the brutality of the police. We will breathe. Power to the poetry. Love and peace. You know, again, I feel like it's hard out here just to live life, and you know, being Black on top of that is just so much more. And so that's why I really believe it's it's really important to have these conversations because we're already dropping dead in the streets from things that really shouldn't even be. But there's other things that we can take measures, like wearing our mask, you know deciding whether we need to get the vaccine if that's something right for us, so we can protect ourselves, because we're already up against so much. And so before we get into our interviews with our amazing guests, I'd like to mention something, and I'm gonna go ahead and share my screen. If you have decided to go ahead and get the vaccine, it's super duper easy, and it's free, and they're available for anyone over the age of 12. You just hop on the Washington State Department of Health's vaccine locator website, and that's vaccinelocator.doh.washington.gov. So I'm gonna go ahead and show you my screen and what that website looks like. So this is what the website looks like: vaccinelocator.doh.wa.gov. And this is the site you go to. You can find an appointment. All you got to do is type in your address, not your address, but your zip code, and then you can find appointments everywhere. And it also shows you the location and then what vaccines are actually available. So I really believe this is a super duper cool tool. So if you don't already know about that, we'll drop the link in the chat as well. And we want to show a few videos as well before we get started. We had an amazing guest about 2 conversations ago. It was Dr. Ben Danielson, and he just has a short PSA for parents, and he's a physician and professor at the University of Washington, and just a tireless advocate for access and equity in healthcare here in the Tacoma, Seattle area, and honestly just an absolute amazing human being. So I'm gonna go ahead and share my screen as well.
I'm Benjamin Danielson. I'm a pediatrician and a clinical professor with the University of Washington. Families feel confused and concerned, and they're really looking for someone that they feel like they can trust. One of the things I want to say to parents is, you got to make hard decisions for your kids every single day. This is another one. The best decision for your health, for the health of your child, and for the health of the communities around us is to get vaccinated.
Being a grocery worker, we've been here the whole time since the pandemic started. We've never had the option of working from home. We've been constantly surrounded with people in the store. One of the biggest concerns being a frontline worker is actually going home and infecting my family. When the option to get the vaccine came, I was not hesitant to get it. I wanted to get it.
So, just a couple videos from 2 frontline workers, one a doctor, one a grocery store worker. And I really want to give a huge shout out to all frontline workers. And with that being said, we're going to go ahead and get into our interviews. We have, again, some amazing guests. So our first guest is Dr. James Greene. Dr. James, thank you so much for being here. Appreciate having you. Just would love for you to introduce yourself, tell the people a little bit about who you are, what you do, the amazing things that you've been doing, and what it's been like to be in the front line during this pandemic.
Yeah, well, thank you very much. And I really appreciate you inviting me and getting me to be part of this discussion. So a little bit about myself. I grew up in St. Louis, Missouri. I went to public schools there. I went to medical school and college in Kansas City, Missouri, did my residency there. But I always had an eye to living out in the Northwest. So as soon as I had an opportunity, I looked for a job, and I was hired at what was then Group Health Cooperative. I started my career in Seattle at Capitol Hill for about 10, 11 years, and I moved to Tacoma with my family. And I've been in Tacoma now about 22 years. And fell in love with the field of OB/GYN. Even in high school, I had an idea that this is what I was going to do. And it's been just a direct path to this, basically my whole life. And as you mentioned in my bio, the last several years, I started transitioning to some administrative work. And the last 4 years, I've been the program and or service line chief for obstetrics, oncology, midwifery, family practice OB for Kaiser Permanente, Washington. And that allows me to, help develop programs and build out the departments and, try to get out in the community to try to help where Kaiser can actually be beneficial to the communities where we actually are providing care. And one of the things that I was going to make sure I wanted to mention that if there's anyone out there that has high school students, college students, medical students that are looking for mentors, we've developing a program at Kaiser Permanente called I Am, or Inspired Allied Mentors. And we're trying to reach out to kids in high school, college, and medical school who need that hand up, and get connected with people that are trying to help you get further in the career, learn more about medicine, give you connections and all that. So you could, if you know of anybody, you got my email and let me know and I'll try to get them connected with this program that we're developing. But as far as COVID, I'd have to say that it was quite a eye-opening experience. And I was thinking today about this. In medical school, we learned about viruses. There's a class called virology. And I remember when we heard and learned about viruses and how they mutate and what they can do, I looked up the friend of mine sitting next to me and we said, we are in big trouble because these viruses have this ability to mutate and change and adapt and become more infectious, learn how to spread faster, quicker, learn how to protect themselves from the antibodies that we can produce and create against them naturally. And they are probably one of the more amazing organisms in our environment. And to that purpose, it's important, I think, for us to be aware that we have ability to fight these things. And the only way we do that is through vaccination. I don't know if there's many people on this call, maybe Kevin or Elizabeth might have actually had chickenpox. And that was not a fun thing to deal with at all. And the fact that you can take a shot and maybe have a little febrile illness, feel a little bit, bad for a day compared to a week of scratching and itching and feeling horrible. And now we have a world where that really doesn't need to exist. And I think about, polio and tetanus and diphtheria, all these things that we have ability to guard ourselves against and protect ourselves against. And to me, it was a no-brainer that when the vaccine was created, that I was going to be out there to get it. And I was one of the first in our organization to do so back in December, because I was afraid. Here I am, Black man, got hypertension. Unfortunately, I am overweight. I was fairly convinced that if I contracted, and I've got asthma, I was fairly convinced that if I caught COVID, I was afraid I would die. I'm not going to lie. And I was in situations where I was seeing COVID patients. We had pregnant patients and patients that had gotten a lot of conditions that came into the hospital with COVID-19. We're in those isolation rooms. I had to put on the PPE, the Kepler circulating air mask and everything. And, I had to go in and see these patients, but, I was concerned, that I would get sick and be ill, or that even worse, I would maybe bring it home to my family and have my family get sick, or people that I love get sick, of course. So when the vaccine was available, I did read up about it. I know there's a lot of concern about it because it's new. It didn't go through as much testing as some of the vaccines that we have. But when I read about it and learned that it was created through messenger RNA, which was the exact same way Ebola vaccine was created. And a lot of us know about Ebola. It's one of the worst viruses that we've seen ever, and it hit our motherland country of Africa hard, still does, but it was the same development, same process. And in terms of pregnancy, Ebola vaccine was given to pregnant women, and it's been tested in that regard. So I knew that if Ebola vaccine was created the same way with messenger RNA, and this vaccine, at least for the Pfizer and Moderna, were created the same way, I felt fairly confident that we could safely vaccinate pregnant women or women that intended to get pregnant safely, and not put their lives at risk to get the vaccine. I knew for sure that pregnant women had more chance of getting severely ill if they contracted the coronavirus than if they took the vaccine. So I've been a proponent of vaccination for coronavirus, COVID-19, ever since it's been available. I did hesitate a little bit when we heard about Johnson & Johnson and the women getting the blood clots and having, some deaths in that. I did advise against women getting the Johnson and Johnson vaccine because it seemed like they were affected adversely in higher proportion than males. So I always typically did recommend people get the Pfizer Moderna vaccine over Johnson and Johnson, but I did not at all hesitate to recommend getting the vaccine for multiple reasons that I just sort of outlined.
Thank you so much for that, Dr. Greene. And so, being an OBGYN, you are working, with pregnant women. And so what was there any concerns or questions that they raised quite often that you might have had to combat or answer?
Yes, there was, well, because there was a lot of information out there that women that got the COVID vaccine might increase their rates of infertility. And so that was I don't know where the news story came from. It has been tracked down, I think, to a couple of sources, but that was erroneous information. That is not the case at all. That was one of the big questions that came up. But then for pregnant women, they were concerned that if they got the vaccine, would they get sick? And how might it affect their unborn child? Would the baby potentially get sick if they got the vaccine? And we were able to tell them, just like I was mentioning about our experience with the Ebola vaccine and being divided the same way through messenger RNA, we did have that information to know that there was no evidence that the babies in the womb would be injured or at all damaged. And in fact, it probably gave them a better chance to be born well, because if the mom was protected against getting coronavirus, there's less chance that the baby would be exposed if they were born at the time that mom was infected. So there's a lot of positives all around in my regard.
So, has with your experience working through this pandemic, has there been any births where the babies had actually contracted COVID from the mother when they were born, and were they okay? I'm just curious if you have any of those experiences.
I didn't have any personal experiences, but we did know of a few cases where there was some suspicion. I don't know personally of any positive cases of transmissions of moms to babies, but I have to guess that there might have been, but I don't know of any.
Okay. So before the show, me and you were talking, and we were talking about kind of mistrust for doctors, especially when it comes to the Black and African American community. And we're talking about how, you are a Black and African American doctor. And so I just would love for you to talk about a little more about your experience being an African American doctor and, trying to work with African American community and, any adversity that you've come up with personally, and then also maybe with your patients as well.
Right. And I think that historical distrust is well documented, and it's well founded. I mean, historically, um, Black populations have been, treated unfairly. They've been tested on unethically, and many people have not had the ability to see a provider or clinician of color, whether they're nurses, medical assistants, you name it. There's just not that many around. And then when you combat that with the fact that this vaccine was, sort of fast tracked and didn't have as much information or science behind it, it was harder for people to want to maybe adopt that. And so it has been a challenge to try to give people that peace of mind that it is a safe thing to take and to be administered. My personal experience, I think I've been very fortunate to work with people that have viewed me as a credible source, whether they're, African American or people of color or not. I think I've been very well received. I've been very thankful of that. I think that's a little bit to the environment that I live in. I do know that where I was training in the Midwest in Kansas City, I did come up against a lot of racism, primarily some unfortunately white people that didn't feel like they wanted to be treated by me as if I was maybe unfit to, be their caretaker. And some people learned over time that that was not the case. Some people, still had their thoughts, but I haven't really run up against that out here. I think that generally speaking, people generally are a lot more open-minded relative to where I grew up and where I trained. So I've really just gone out of my way to really take the time to talk to people and hear what their concerns are. And I think that's what most people really want. They want to be listened to. They want to let them know that you're hearing what they have to say and that their fears or concerns are legitimate. And then at least talk them through, at least why you think or why I think it would be a safe thing for them to do or in their best interest to do for one reason or another. And, most people that I've talked to have, come around and considered doing it and or done it. I've had come across a few people that, are too concerned and too worried right now to do so. And I give them that space. I think people have the right to, be, um, what's the word I'm looking for? Discretionary and look out for their own health. But I do feel like people that have multiple morbidities like diabetes, hypertension, obesity should really think, and especially if you've got any kind of lung disease, I'd really think strongly about getting the vaccine.
So, Dr. Greene, you've been in the medical field for a very long time. Has there been any kind of ideas or initiatives that you have personally thought of, or maybe even committees or things that you've worked on to build a better relationship of trust when it comes to the healthcare system and the African American community?
Well, I know that within our organization, we've been taking strides to actually do these anti-racism forums as a organization and enlist providers all across our organization to enlist in these classes and do these physician-led and or other provider-led small talk groups to talk through and teach people what systemic racism is about, what microaggressions are about, what your biases are, and sort of break down those walls and open up people's eyes to what people of color, Asian Americans, Native Americans have been dealing with all their life, and that other people just have not been aware of because they just haven't seen it, or they've seen it but not known what to do about it, or they just are so unconscious to what's happening that they are part of the problem. So I'm very glad to say that our organization has taken that approach and have actually gone out of their way to really try to promote that education within our system. So I think it starts from the grassroots, to start from the ground up, to work with, providers to let them understand what people are going through and open their eyes and hopefully become better clinicians and be able to treat the people that they come across and see in a better way.
Absolutely. So, well, I have actually two questions, and these actually come from my mom. And so she really has, I guess I'm putting it on blast. It's too late now. I already said who it was. But she really has hesitation for the vaccine because it's not FDA approved.
Mm.
And she's like, that's not good. So what can you say to that?
Yeah, and that's what a lot of people do kind of have their concerns about. And I thought about this too today because there are a lot of, I was trying to think of some examples, but I couldn't really come up with any right away. But there are quite a few medications that we use that are not FDA approved for what they're used for. It's called off-label use. Um, so there are medications that we know their mechanisms of action, we know how they work, and we know some things that they do. And I've got an example maybe. So there's a medication called spironolactone, which is a diuretic or a water pill, often used for swelling, heart failure, hypertension. But we know that it lowers testosterone levels. So in my field, women that have elevated testosterone levels that cause, acne and hair growth on the chin, we use spironolactone basically off-label to treat that condition effectively. We know the things that we need to watch out for in terms of side effects. So there are many medicines, treatments that are out there that are not FDA approved, but are actually being utilized in medicine for the good. And we know how to do them safely because of how, like I mentioned, the pharmacology or the mechanisms of action or how these medicines actually work. So that is reason enough to be skeptical, but I think based upon what we know, I think we can get over some of those things and some of those hurdles.
And so, is there a reason specifically why the vaccine hasn't been approved from the FDA? Is it just there hasn't been enough time yet?
Yeah, I think so. I think they do want some more time to gather all the evidence and make clear decisions. I think it's really a matter of time. Like we mentioned, this is the fastest that a vaccine has ever been made and gotten to market. And that's a testament to the science that we have now in the world and that the collaborative efforts that there are. But at the same time, I think it is prudent of the FDA to kind of take their time and make sure they did do the emergency use exception which is why we're able to use it right now effectively. Um, but I do think they want to have all the information available and enough patient exposures to be able to put that stamp on it. Because once you do that, there's a lot. I don't know if there's any liability involved with the FDA if they do so. I can understand why they're a little bit hesitant, but I think at this point it would be helpful probably if they would go ahead and go ahead and give that formal approval.
Yeah, I think you hit it right on the head, Dr. Greene. I think a lot of people are like, well, this is the fastest they've ever done a vaccine, but also this is the best technology we've ever had in the history of technology and, medical advancement. So I think there's a really good point right there. Another question that I get from a lot of people also is, well, if I take the vaccine, there's no way of knowing how it affects me long term because it hasn't been possible to study what happens after, 10, 20 years taking the vaccine.
Yeah, and that's true because we don't know. Like I said, we can point to the Ebola vaccine, which was similarly designed and created, and there is some longevity information regarding that. Granted, it's not the same virus that we're fighting. It's not the same vaccine, but it's the same type in terms of how it works with the messenger RNA and works with the coding of the virus and its inability to then attack and attach to cells and then become physically active. So I think there is some truth to that, but I would say that the short-term information, because for me, I'd rather at least be protected against something that I know could potentially kill me versus something that might potentially cause some problems down the line that we don't know about. That's at least that's my viewpoint.
Yeah. Well, Dr. Greene, it's been a pleasure talking to you. Is there any, last words or advice or comments you want to give to anybody kind of, I don't even want use the word hesitant, but, considering whether to take the vaccine or not, and just really wanting some guidance on helping to make that decision?
Right. Well, I think it's fair for people to be hesitant and to be and scrutinize and to and take their time. But I think that we're learning at this point that the safety profile of the vaccine is sufficient versus the degree of death and illness that the virus itself can produce. That I think that at this point the benefits definitely outweigh the risks. I think if you have any concerns, please reach out to your personal provider, your care team. Have an appointment just to talk about it if that's what it takes. There are nurses that are available at many clinics across the counties that are willing to talk to patients and give them information, answer your questions, and if you have questions, by all means ask. There's no reason that you shouldn't. I think that people do get afraid to ask questions of medical professionals, but I think that's what we're here for. That's what we're here for, to answer your questions, help you feel comfortable. And, if you are a Kaiser member and you want to talk to me, by all means, make an appointment. We do phone visits. I'd be happy to talk to anybody anytime about it.
Well, thank you so much, Dr. Greene. I appreciate you answering my questions. You have been an absolute pleasure. Ladies and gentlemen, Dr. James Greene, Kaiser Permanente. If you're in Tacoma, check him out. He's amazing. He's over at MOK. Appreciate you so much. So now we're going to go.
Thank you.
You're welcome. We're going to go ahead and have our next guest come on. And this man is absolutely amazing. He has been one of the biggest impacts on my life and a huge mentor for me. So I was just super excited to have him on and that he agreed to come speak. I think what he does is so important, and his perspective is a perspective I think that hasn't been considered by most during this pandemic. So we have Kevin Roberts joining us. Kevin, how are you doing, man?
Let me make sure I'm not muted. I am not muted. Okay. I'm doing well. Just staying busy. There's always something to do. So there's got to be somebody to do it. So I guess that's me. So yeah, I'm doing well.
So Kevin, can you tell us a little bit about, what you do and the populations you work with and what it's been like being on the front line during this pandemic and dealing with COVID and also, dealing with the vaccines and things like that?
Well, so my most of my career has been, or all of my career has been healthcare. Most of my career has been with community healthcare. And a few years ago, I actually went to school for nursing, and then had to stop school and get back to work for a little bit because there's some unexpected life changes. But I always meant to get back to school, but my company just kept they kept promoting me, and so and giving me different things to do every time I tried to leave. And so my opportunity to open the homeless clinic, or the healthcare for the homeless, SeaMar on 11th Street, it was an opportunity to serve my community, the community I grew up in, the community where many of my friends back in the day were shot and killed on those streets. These are people I did finger paintings with when I was in kindergarten, that in just a few years would become, killers. I was fortunate enough to be able to leave Tacoma and go into the Air Force a year after high school. I just left and came back with a fresh perspective. And I started to teach Sunday school. And I think that's where me and Bethany crossed paths. She was one of my students, but we always had a really good connection. And I started looking at young people in the sense of that the book The Catcher in the Rye, where they're playing in the rye field and there's the cliff over there, they don't see it, and we're supposed to catch them and throw them back, try to keep them from the things that we've learned. That's a preventative sort of thing. So fast forward to today, I would always worry about my patients when they leave, because I knew there were certain conditions in their homes and in their living situations that would not allow them to follow through with the healthcare plan. And sure enough, when they get back, their diabetes was still not good or worse, and I saw these disease processes in stage, and I saw generations of people in the system that is, they're on welfare, or they're actually in the penal system. And I cared a lot about these people. We start them with their vaccinations. We hope for the best, but then you see these processes just continue. So I'm running the clinic for the healthcare for the homeless. I'm realizing that they come in for healthcare. We had showers and laundry. We had a chemical dependency guy there. We had behavioral health there. We had case management there, and some food options, and that's still going on. What I noticed is that we had to address the issues within their lives in order to have these outcomes that we, desired. And so these social determinants of health are what we try to do with when I'm running this program. That's what we try to address. And so the community health action team consists of a nurse practitioner, a behavioral health specialist, and about 4 caseworkers that go out, and also a medical assistant who I'm in the process of hiring now. We go out in the community wherever the homeless people are. And so we have been on DOT land in Fife, back up in the trees and the brush where these elaborate encampments are. Just amazing what they're able to do. Carpeted tents with, they had a countertop with a spice rack on it and a bed and a couch, and you could stand up. Those are the types of tents that they're living in. And they had some solar powered cameras, that sort of thing. We run into all types of different situations. Sometimes the cops, the police officers will call us to go out to help clear an encampment, to provide services, to figure out where they are. So the whole idea for us is to go out and provide the medical care, but also listen to them and see what sort of lifestyle how are they living? What do they really need? What are their priorities? And then also assist them in getting back into the system. So serve as a bridge back into primary care. We try to reduce their ER visits by getting them into primary care as well. We connect them with their behavioral health resources. We try to get them into to rehab if they're going into any type of, any of those types of services. We try to get them housing. Whatever the issue is, we try to address what are the social determinants of health that they're experiencing, the things that keep them in that cycle going back out on the streets. So it's domestic violence. It's a lot of mental illness, a lot of it just not addressed. Many of these people don't know that services are available to them, and they're just out there because they don't know. Countless older people are out there, and they qualify for a home. We've gotten out there and got adult protective services to come and get those older people to go into a healthcare, a long-term care facility, which they didn't know because they're rural. They're in Ording and they don't know anything. There's no information that's getting out there. There's no internet, so they don't know. So pretty much what we do is all over Pierce County. It could be unincorporated, it could be in the inner city, that they sleep on the doorsteps of all these agencies that can help them, and they don't go inside for some reason. And so we are on the streets and we're trying to ask them why, develop a relationship. I know the priorities for them might be to go into a treatment and get a doctor. So go into a treatment program, get a doctor, get you stabilized so you can start working, get you housed. But they want shoes, that's their priority. This one person said, I will go to, rehab if you buy me a pack of cigarettes on the way there. And so we're unconventional. They got in the car because of that pack of cigarettes and went to rehab with us, And so it's like, what's important to you? Let's establish that first. Let's get to know who you are. Let's listen to what your needs are. And let's try to, bridge the gap between, the services and the people who don't trust that, any of these institutions.
Well, again, Kevin, thank you so much for what you're doing, because it's so important. And like you said and addressed, they're dealing with so much. And so then we have, COVID on top of that. And honestly, it might not even be a priority, but what has it been like, working out there in those communities and navigating with COVID, and then also, receptiveness to getting the vaccine and whatnot?
Well, honestly, as I said, there is a tremendous gap between their world and ours. They will come in for services, but they don't feel comfortable, talking to people with a job. They told me one day I was rich, and I was like, okay, I wish somebody would have told me that. But that's their point of view, is that people who work don't worry about the things that they worry about, or don't worry about a thing. Some of them say that. Some of them don't want to be in the system. And it could be because of mental illness, the paranoia, schizophrenia, sometimes that plays a role. Sometimes it's just like the ignorance. We don't know. We don't talk to those people. We don't trust those people. So, and then they hear whatever information that does get out there is not correct information. And a lot of it inspires the fear. And so I would say it's less than 10% of the population that I've come in contact with are vaccinated or even want to. And then there are those who do, and it's only a few. I can probably count on one hand how many that I know of that said, yes, no problem, I'll take the vaccine. And so we just work at developing a relationship with them to where they trust us. And a lot of times it helps. Once they get going with their healthcare, then they're receptive to a lot more things that they weren't before. So it just takes a little bit longer of an outreach to get them to come across, because they have their stories and reasons why. Lots of injury and damage, lots of mistrust, and so it could be, if you're undocumented, of course you're fearful that ICE is going to be there, so you're not going in. If you have priors, then you're not. That's a barrier to care, because you think that, a lot of them thought we were with the police when we come out to the encampments, and we have to, assure them that we're not, unless we are coming with the police. And in that time, we have to make sure that the cops go in and say, hey, we're not running any names today. We're all about services, and these people are here for that. And we've had some very good partnerships with the HOT team here in Tacoma, and the sheriff's department in Pierce County, and those different things. They will call my nurse practitioner and say, there's a guy over here that has a really crazy wound, and those types of things. And again, the priority is really, their priorities are different. So if you go and talk, a shot or any healthcare, a lot of them, that's not their concern. Their concern is the survival. Some of them, their concern is the fact that, you know, the drug dealer is right there, and that's what they want more than anything, because they're still in their, you know, addiction loop. Um, Sometimes there's the prostitutes that are there, and the pimp is right near, and they don't want services as long as he's standing there. But as soon as, you know, she gets a moment alone, it might even be another day, then she's like whispering, and she's like, hey, you know, what about those services? So we it's the long game for us. It's like a fishing, you know, trip where you throw your rod out there, see if you get something. Today we may not, but we also try to bring something that they might use and create that relationship. And it's a long game. But for right now, yeah, the numbers aren't very big. And it's misinformation. It's they're paranoid. If it's a religious thing, a lot of them out there say that's the devil's work. I've heard so much.
Wow. So do you feel like there's been and there are enough resources going, to help these communities and populations, or do you feel like, I mean, I think obviously always more can be done. I guess what would that look like if there was proper resources and adequate services and things like that?
So the ideal situation would be medical and behavioral health, you know, working together, and that includes behavioral health psychologists, those who could prescribe medications, as well as chemical dependency specialists, all working together in the same building. And then also social services, and all of us being aware and all of us communicating as well, because they enter the system with different agencies here and there. And some of them, if they don't get what exactly they want at one agency, they'll go to another agency. And if we're not talking, then we don't know who that, what that, that person's natural propensities are. And so what I'm encouraged about is the county has, there's some grant money that we've been fortunate enough to get from the county, as well as some other agencies that are legacy agencies here in Tacoma, comprehensive life resources, and the multicultural Tacoma multicultural on 19th Street, and Associated Ministries. And each of us have a different solution, and we've all been talking for months now, collaborating more than I've ever done before on outreach and rapid rehousing solutions and different things. And so those are the things that we're doing. So I'm encouraged. I think that there are a lot more resources than anyone would know, and creative ways to get the services and the help that they need. We could use more behavioral health options though, because there are a lot of people. I've hear my nurse practitioners say they're refugees of the behavioral health system. A lot of them are out there. They're not sick enough to be committed, but they're destructive enough to themselves and sometimes to in society, and they're just suffering. And people, they don't understand. They see the homeless person as, oh, they've made choices. As addiction is just something that somebody just really wants, and not as an issue. So it is a societal problem, and I believe society has the answers. If we all work together, then no one person, no one agency would have to do all the heavy lifting. And I believe the conversations are beginning within Tacoma. All the agencies that I've just talked to every day, it's amazing. We're already moving to be able to house lots of people, or find temporary housing solutions while we work on some of their social determinants of health. So really, we want them to be able to be stabilized so they can entertain the solutions that are available. And so that's the work that we do.
Absolutely. And I just appreciate you taking the time to come on here, because I think I'll at least speak for myself. I've learned so much, and these are perspectives I never even really considered. And, so these people aren't even necessarily not only dealing with, COVID and the pandemic, but like they're dealing with so much more. And there's just so much going on. And honestly, sometimes in the world that we live in, we're blind to that and not even, paying attention at all. And so I just appreciate you bringing these perspectives. And again, thank you for the work that you are doing at SeaMar, because it's necessary and so important. And yeah, mental health. I think mental health is such a big topic. And that's like another pandemic, is the mental health pandemic. There's so many different pandemics going on, and that's why we just have to come together, have conversations. You touched on another thing, communication. Communication is so important, and communication at every level about all kinds of different topics. And so that's what this show is all about, is communication, about this COVID-19 and this vaccine, and sharing perspectives. And so I'm so happy that we've been able to accomplish that. And so, Kevin, just really appreciate you. Thank you for coming on and
Thank you
letting
for
us
having
know
me.
about the work that you do. Again, I want to thank Dr. James Greene for being on today and sharing his perspective. Thank you all for being frontline workers and being out here in these streets, doing the work, helping people, saving lives. It's so important. This has been Courageous Conversations. This is the 5th and final episode. It has been such a pleasure. Honestly, I have learned so much. Again, if you want to see old episodes, they are online, so we'll post that in the link. We're going to send out emails and everything like that. I'm going to end the night with some poetry. And this piece, it's called Infinite Gratitude. I think, especially from tonight, realizing that gratitude's so important, and just appreciating what we have, the opportunities we have, the things that we're able to learn, and the conversations that we're able to have with our community. It's honestly just a beautiful, beautiful thing. And this really makes me feel good about our world and our future, and just knowing that there's so many amazing people out here doing this work, and that we have young people out here willing to have these conversations like myself. I'm just so blessed to be able to do these conversations, and I look forward to all the amazing work that I have ahead of myself. I'm actually going to be a part of a statewide mental health campaign, so I'm super excited about that. I think all these go hand in hand. And just talking is the first step. It really is. And we just have to build up this trust and consistency. And I can at least speak for myself and just let the community know, like, hey, I'm out here. I'm doing the work. I'm all for the community. I'm going to keep doing the work. And that's it is what it is, and that's all that matters. And so we're going to end the night with this piece called Infinite Gratitude. I'm done fighting back my tears. I now choose to embrace them. My demons, I done faced them. I no longer internalize hatred. I'm tremendously grateful, so I always say thank you. Absolutely appreciative. Just know that I'm thankful for all the blessings this universe provided. I look toward the future, never short-sighted, embrace opportunities, never indecisive, never undecided, because no task is too giant. What we focus on expands. So for me, I choose to focus on statements of I am, I can, I will, I do, I want, I love, because our thoughts become things, so I believe in my dreams. I have control over my own reality, enjoying the positive energies of those who share my same mentality. Good vibes is what I choose to surround me. I practice meditation, allowing for me to maintain my consciousness, so I remain an optimist. Your girl don't quit. I do the exact opposite. Failure is not a consequence. I use what I learned to propel like a rocket ship. There is no limitations for ambition and confidence. I set my goals and then I accomplish them. I treasure the gifts I've been given. All the souls who listen to my poetry, words I speak stemming from my intuition, emitting an aura of abundance and love, so I glisten. No longer holding on to negative beliefs. Practice what I preach. Live what I teach. Light, she is me. I close my eyes and I still see. I'm tapped into the frequency. But nah, I'm not perfect. Sometimes I slip up, but I always get up. I don't beat myself up. Instead, I show myself love. Remember, setbacks lead to breakthroughs. So when adversity is present, let us all prefer to say thank you. Practice what you preach. Tap into the frequency. Power to the poetry. And so, again, thank you, everyone. And that last line, remember, setbacks lead to breakthroughs. And yes, this pandemic, COVID, has been major setbacks police brutality, racism, major setbacks. But all a setback is a setup for a breakthrough. And there's been so many breakthroughs. We look at this vaccine, it's an absolute breakthrough. We look at the wonderful reform happening in this country, so many breakthroughs. And so, you know, again, what we focus on expands. So let's focus on the good, and let's, you know, address what the issues are and come up with solutions. And I'm just so happy I can sit and talk with people who are offering solutions, who have such a positive and optimistic outlook on the world. So again, thank you all. Love and light. This has been Courageous Conversations. I'm B Lyte. Peace out. Oh my gosh, this has just been a pleasure. Have a great night, everyone.